Well, some folks used to believe ADHD was a concern mostly for boys or men, but that's no longer the case.
More women are being diagnosed with ADHD as adults, and Kimberly Gill is here to explain. It's a topic a lot of people are talking about. I know they're researching it on social media.
They really are, and one reason could be that new diagnoses have risen in all age groups, according to a study that looked at patients diagnosed from 2010 to 2022, but especially in women. Epic research found the percentage of women diagnosed in their 20s, 30s, and 40s has doubled from 2020 to 2022.
Looking back at her life, Jessica Rodriguez can see the early signs of ADHD.
A lot of disorganization, a lot of feeling frozen, like you know how much you have to do, but you can't actually get yourself to complete it. Making massive lists of all the tasks I have to accomplish, and none of them actually get done because it's too overwhelming to get started.
The 36-year-old is a special education teacher with two neurodiverse children of her own.
My symptoms definitely got more severe as I became a mom, and trying to work as a teacher in a building with educators who generally don't struggle with executive dysfunction and are generally very type A, which is why school works so well for them.
I had a difficult time finding scientific studies and research that explores the topic of ADHD in adult women. But a quick search on social media shows Jessica is not alone. On TikTok, the hashtag Adult Women with ADHD has millions of videos and views. Celebrities such as Emma Watson, Lisa Ling, and Simone Biles have all opened up about their struggles with ADHD.
I have adult ADHD.
Former Atlanta Mayor Keisha Lance Bottoms speaks specifically on social media about receiving an ADHD diagnosis as an adult later in life.
It takes away from our ability.
Dr. Sarah Kipperman is a licensed psychologist at Corewell Health's Center for Human Development. She's also been friends with Jessica for the past 25 years.
Growing up, we met in 7th grade, and in any class we were in together, she always knew the answer. I could count on her to get reading done in no time, and debate or anything, she just knew what's up. Like, she was and is like one of the smartest people I know, hands down.
Jessica's teachers probably thought she had everything together too because her ADHD symptoms weren't disruptive or hyperactive. Her behavior was very different than many boys who are diagnosed with the disorder.
Traditionally, when we think of ADHD and like when we're diagnosing in schools, with boys, stereotypically, we're seeing more, there's that exhibiting of behavior of being out of the seat, or like looking for more outgoing behaviors that we observe, versus in girls from a young age we tend to see more inattention, which is harder to spot. So from a young age early on in schools, we might be more likely to misdiagnosing girls based on gender norms, based on how we track behaviors.
When Jessica was old enough to articulate her feelings, she too was misdiagnosed.
I was diagnosed with depression when I was 14 and have been in treatment on and off for the last 12 years. So a lot of my symptoms were usually attributed more towards depression than ADHD. After I had my kids, I had several doctors tell me that, oh, it's just anxiety or it's postpartum that's complicating things. This is normal, this will go away, those kinds of things. I think it's really common in the medical field to attribute especially struggles with women to depression and anxiety instead of looking for a different cause.
How are you managing your life now?
I've definitely found some strategies on social media that have helped. There are definitely still areas where we as a neurodivergent family struggle. Homework's a big one. Mm-hmm. If it makes it home, remembering as a family to get it done and getting it back to school are all executive functioning tasks, and the three of us don't have those skills. But one of the things that I figured out is they don't have those skills because their brain works like mine, but I have a lot of coping skills that they need. Mm-hmm. So teaching them those is much more important.
Yeah. So if you recognize some of those symptoms in yourself or have suspected you might have ADHD, Dr. Kipperman says you need to ask yourself if it is significantly impacting your life. And if that answer is yes, she recommends talking with your primary care physician to learn about the initial steps of being evaluated.
Now, you talk about coping, which is hard because there's not a lot I mean, there's medication,
Sure.
there's social media, but like, what are you really supposed
That's
to do?
that's such a good question, and I'm barely scratching the surface on this topic. I've recently learned of several local ADHD coaches who work specifically with adults on how to manage their symptoms. I'm going to put some of those resources on this story on our website, clickondetroit.com. But I have a feeling that my reports will continue on this because there's been a lot of interest. A lot of people have reached out to me after seeing the commercials about it and saying, you know, I've maybe thought this, but
And I think a lot of moms, because we're multitasking
Yes.
so much, I know I sometimes wonder, like, you know, we're getting all this done. Am I doing it the right way, or do
Exactly.
you have ADHD?
Exactly. So certainly reach out to me, kgill@wdiv.com, if you have a comment or a suggestion. But it's something certainly I'm interested in,
It's an
and
important
a lot
story.
of people, really are. So
Thanks,
thank you.
Kim. Appreciate it.